This project was a joint working project between Guy's and St Thomas's, NHS Foundation Trust and Boehringer Ingelheim, and it really focused on the interconnectivity of cardiovascular, renal and metabolic diseases. We know that our patients have all these common conditions together, and it's about early identification because we now have tools to actually prevent the progression of those individual cardiac, renal and metabolic complications. So the project focused on early intervention in the community, but in parallel we did some work in the hospital where people with existing advanced disease could be prioritized to ensure more efficient delivery of our outpatient care.
We have so many patients who have different conditions, heart problems, kidney problems, diabetes for example, and they have so many different appointments with different teams, and we just wanted to make it really simple, make it work for the patient, bring things together, so reduce the number of appointments, make sure we communicate better.
South East London is a really diverse area, lots of socio-economic deprivation as well. We know that we're working in a system where there's a lot of pressure, and one way of alleviating pressure is working as a team and working more cohesively and ensuring that for patients, especially those who have multiple long-term conditions and multiple conditions that might have been treated in silo, if we can bring their care together, which equates to bringing together our clinical staff and our non-clinical staff to care for patients in a more holistic manner, I think both patients and our staff will really see the benefit.
This project focused on a diabetes heart failure pharmacist and someone to collect data to look at the impact we can make in the community setting in terms of prevention and optimization of guidelines.
So we worked with a GP practice in primary care to run searches through their clinical system, and that search was to help us identify young high-risk patients that are at risk of developing cardio-renal-metabolic disease in the future. Prevention is a key part of what we were trying to achieve, so we want to identify those patients early so we can introduce those evidence-based treatments that we know work and we have evidence behind their use.
And by identifying people early and delivering a joined up approach led by a pharmacist in diabetes and cardiovascular disease, alongside someone to support with data capture, to look at the analytics, to see the outcomes, we were able to demonstrate that this approach working in primary care in a community setting can reduce cardiovascular risk factors, optimize evidence-based therapies, and really one would hope that that over a longer term will translate to a reduction in the burden or prevention of complications.
We've really seen in this project that patients have done better when we're more coordinated, when we work better with each other, and also when we work better with our patients, when we empower the patients to understand why a test matters, what we're looking for. Also, what we're looking for in terms of symptoms, what symptoms matter to the patients, when should they call for help.
I've got type 2 diabetes with heart failure. The support was amazing. They're amazing ladies to put me through, and I feel really comfortable. I've never missed an appointment again. I've never missed my medication. I've got lifestyle tips from them. I've got like my general eating habit, exercise, and on the other team I've got my diabetic nurses that tell me, give me books, leaflets, how to eat, what to eat, and I keep practicing that. As I said, the support around me was amazing.
I think the difference that this has made to clinicians is it's opened communication between specialist teams. Working with Boehringer has been really beneficial to the project. I think it's with their expertise in project management, data analytics, just knowing what data we need to collect and kind of looking at that picture as a whole and being able to analyse it and present it in a really cohesive way. I think it's been really beneficial.
I'm hoping that this approach of working in the community with primary care can be sustained, and we are very fortunate that the person who was in the post has got another similar post to continue this work across cardiovascular, renal and metabolic, and the learning that we have got from that will also ensure that this post and this project can continue to deliver to our local community in South London.
We have to continue to look to that going forward in order to ensure that we're making the most of every kind of patient contact, every opportunity that we see in healthcare. We have to work out how we can do it and think outside the box, and I think working with industry is one of the ways that we will be able to achieve kind of the goals that we have shared with patients.
I used to feel fearful, I used to feel isolated, I used to feel down. This group of people that was looking after me. I felt I can go in the park now, I can walk, I can do exercise, and I just feel different. I'm not that fearful anymore.